So we're primarily seeing this type of response with hyaluronic acid fillers. And I think that's what we've seen in the past too. This response is not new. We've seen this type of response before. We've seen it associated with other vaccines, for example, the flu vaccine. I have another colleague who saw this happen after a patient got the shingles vaccine. So we know that this is not a completely new phenomenon. We've also seen this type of delayed hypersensitivity reaction to hyaluronic acid fillers occur even after a viral infection, like if you actually got the flu. Is it possible that it also will happen after just getting COVID, not the vaccine, but actually having the infection? Yes, it is definitely possible. And this is not a new situation, right? So we've seen this before. We primarily see this in the case of hyaluronic acid fillers. So there are many different types of fillers, right? There is calcium hydroxylapatite, there's polylactic acid, there's hyaluronic acid. Far and away, the most commonly used filler in the United States is hyaluronic acid. So could it be that we're just seeing more of these very rare reactions in the case of hyaluronic acid fillers, predominantly because those are the fillers that we use most often? Very possibly. Does it have to do potentially with the material of the filler? Again, possibly yes. With regards to the types of fillers, a lot of people have asked me, is it more likely to occur with Restylane, with Juvederm, with Belotero? Like, which filler should I use? Which filler should I not use? Is there anything I can do to minimize the risk? So theoretically, we do think that you might be more likely to see this type of reaction in the highly cross-linked fillers, or fillers that are basically last longer in the tissue. So there's something to be said for not administering, if you're thinking about injecting someone and it's in proximity to when they might be getting a vaccine, it might be helpful to administer small aliquots, small doses, not give big boluses of the filler in one particular location. Another technique that anecdotally seems to be helpful with regards to minimizing these sort of risks of these delayed hypersensitivity reactions includes blending. So, taking a hyaluronic acid filler in the syringe, using a sister adapter, another syringe, and blending back and forth so that you're sort of breaking up some of the hyaluronic acid cross-links. When you put them in, they may not last as long and they may not have as much of an immunogenic response. So those are other things to just keep in mind, if you are an injector and you're encountering patients and you just want to do everything possible to minimize the risk.